Every year, natural disaster displaces millions of people. Earthquakes, typhoons, floods, and other catastrophes displace over twice as many people now as they did 40 years ago. Data suggests that women and girls are more likely than men and boys to die from these catastrophes. Pre-existing social and cultural norms are a large part of the problem. Women and girls have fewer economic resources and lower social status before the crisis. This limits their survival skills and impedes their ability to stay out of harm's way. Women and girls who survive are vulnerable to many more threats, including displacement and sexual violence, loss of health services, and financial security. Women and girls drop out of school at higher rates. They're more likely to be married early. Sexual violence increases their risk for sexually transmitted infections and unintended pregnancies. At the height of the crisis, they are more likely to give birth without skilled attendants. As a result, women and girls are at higher risk for reproductive health illnesses and death. Since 2010, the Women's Refugee Commission has worked on disaster risk reduction. Before catastrophe strikes, we provide women and girls in disaster-prone areas with the skills, knowledge, and resources they need to stay safe. Our intensive trainings help communities to plan and prepare for disasters. We help them map out reproductive health needs, the obstacles that may arise, and the solutions that can be implemented. When disasters strike, the communities are prepared and the women are safer. Community involvement from the initial planning stages is critical. So the Women's Refugee Commission works to include women, girls, and other vulnerable groups, such as people with disabilities and older men and women. On a national and global level, the Women's Refugee Commission advocates for emergency preparedness. We're working to ensure that local organizations have all of the support that they need to protect their own communities. One community health worker in the Philippines told us, "The training gives me more confidence to face those in the community. The information we get from you is very useful, and we're really glad you're here. Please come back again and again."